Well, good afternoon and welcome. My name is Fong Nguyen. I am the Associate Vice Chair for Global Surgery for here at the Department of Surgery in the University of Colorado. I'm also a pediatric plastic surgeon. I want to welcome everyone both here in person as well as online for our inaugural Global Surgery Lecture. We're very honored to host our inaugural visiting professor of Global Surgery. So Professor Ghulam Fayyaz did his graduation from Punjab Medical College in Faisalabad in Pakistan in 1984. He has trained in plastic surgery at Vienna University in Austria. He subsequently received a master's in plastic surgery from Karachi in Pakistan. Since then, he has started the department Burns and Plastic Surgery at Allied Hospital in Faisalabad, starting in 1999. He was there for 6 years. He has established a nonprofit organization, the Cleft Lip Palate Association of Pakistan, in 2003. So it has been in existence for over 20 years. He also headed the Department of Plastic Surgery in Lahore for 14 years until he retired in 2019. So to give you an idea of the scope and size of the work that he and his colleagues have performed, he established a small hospital dedicated to cleft lip and palate patients in Lahore, Pakistan in 2008. And since then, they have serviced and performed surgeries on over 22,000 patients. That's from 2008, which is an incredible number. And they provide a comprehensive cleft care, including audiology, orthodontics, and speech therapy. In addition to all of these roles, he is also the chairman of the board of trustees of the Pakistan Association of Plastic Surgeons and the former president of the organization as well, and the general secretary of the Cleft Lip and Palate Association of Pakistan. So we are very honored and privileged to have Professor Fayyaz come today to give his experience on all the intricacies of setting up all of these programs to provide a comprehensive care. So without further ado, Professor Fayyaz, thank you.
Bismillahirrahmanirrahim. With the name of Allah, the most beneficent, the most merciful. It's my pleasure to be here, and I am thankful to Professor Fong Nguyen to invite me and to give a chance to meet all friends over here. And I'm going to share our humble journey from local to international. So we founded a non-profit organization in 2003. And we perform free cleft surgeries, we provide speech therapy, we provide audiology, we provide orthodontic to all the patients who report to our center. So that's our foundation, that's our slogan, helping them smile and speak. So we are committed to provide comprehensive cleft care. We have done capacity building, we have collaboration and partnerships. We have done a little bit of research and innovation in our techniques. So that's the today's flyer. That's my professor, my mentor, Professor Khalid Durrani. He passed away in 2015 in New Jersey. And that's my picture on his left side, in the upper side. So our journey from local to international has been over many years. I started a department of plastic surgery at Faisalabad. Our main problem was that we had only one OR for twice a week, and we had a 30-bedded department. So our waiting list for admission to the inpatient area was 13 months long. So what we did, we raised some money from the city of Faisalabad. We have many philanthropists in that area. So we constructed and equipped 3 ORs where we could perform as many cleft surgeries as possible. And that was when the ORs were inaugurated. So we have been working with many organizations like Smile Train worked with us 2003, 2012. Then we worked with Deutsche Cleft under Hilfe 2013 to 14. Now we are working with Cleft International Switzerland, Operation Smile USA, Node of Craniofacial Foundation Taiwan, and Smile House Foundation, Italy. So this is part of the history, and we should remember our history. On the left side is Professor Rolf Blacksma, who was from Grand Rapids, Michigan. He served in Pakistan in 1949 to 1954, and he established United Christian Hospital over there. And he was doing cleft surgeries in that very area at that very particular time. And on the right side is Professor Nudaf, who was trained by Professor Rolf Blacksma. So we have a spiritual connection with USA, spiritual connection with Taiwan for the cleft surgeries. And Smilton delegation, especially the Professor David Dingman and Elias Greenwood, they visited us in 2003. So when we were working with Smilton, we performed 14,000 surgeries for them. We organized cleft workshops in collaboration with Smilton. And I have been to Changung Hospital, Taiwan for many, many times. I worked there with Philip Chen, with Langelo and Dr. Kai Fang Hung. I have been there 2002, 4, 6, 10, 8, 12, 14, 19. And this is the picture of my first visit to Taiwan in 2002. And with Professor Nudaf in 2004. And different workshops in 2012, 14, 16, and 19. And this is a dinner organized by Professor Langelo in 2019. So what we have learned over the years, we want to share it with colleagues, because we need to pass on what is our experience, what we should do, and what we should not do. So we organized Cleft Symposium in Pakistan in 2004 with Professor Philip Chen and our friend from Thailand, Govan Silp. Then 2005, we had Ian Jackson, Dr. Langelo, and Dr. Le Hui Lim from Malaysia. Then 2007, then 2009, then 2011, 2013, and then 2015 with Philip Chen. And then we had the last one in 2018. This is our small hospital. We established in 2008, and we provide speech therapy, we provide audiology, we provide orthodontics, NAM, and free surgeries. 99% patients are charged nothing. We provide everything for free. So we started at a very small level, but over this year we have learned what we should do, what we should not do. And our team is very robust, very highly trained, very efficient, very productive, and with quality and safety. Whenever we want to improve, we need to realize what are the needs. Then we need to recruit people who are interested to learn and interested to serve. Then we need to provide them confidence so that they can work independently and comfortably. So we provide comprehensive cleft care at our center. When we did not have the speech pathologist, we usually make a toss whether we should do speech surgery or not. But since for many years, from 2013, so in 2011, we have the speech pathologist. So all our patients, especially for the secondary palate, they go to him first, and he will guide us. Don't do any surgery. I can help the patient only with speech therapy. Or he will say, please go ahead with speech surgery. I will take it later on. So many of the patients have been saved from unnecessary surgeries. Then we had a craniofacial orthodontist, and she was trained for 1 year at Changung Hospital, Taiwan. And we do 15 to 20 NAMs every month. And we provide orthodontic service for more than 25 patients every month. Every Thursday, we have an audiology service, and we provide hearing aids to the patient who cannot hear properly. So what's our Cleft program? We started in, our ORs were constructed in 2002. So since 2003, we were comfortable to operate more cleft patients almost every day, because the ORs were exclusively for the plastic surgery department. Then in 2004, we did 617. 2006, we did 100,000, 1,007. And then we went on. In 2008, our hospital was fourth in the world to do more than 2,000 surgeries. 2008 and 9, we were third in the world. 2009 and 10, we were first in the world. We did 3,657 in 1 year. And then in 2010, we did 4,020, 2,222. In 2011, we did 4,285 surgeries. Then Smile Train stopped our funding in 2012 for their own reason. So in 2012, we were reduced to 1,600 surgeries. And then over the year, we got other donors. So again, we are doing many cases every year. In COVID, we were doing quite less number of surgeries, but now we have picked up the pace again. Up till now, my team has done 46,000 cleft surgeries, 22,000 at our hospital, and we also do missions in Pakistan. So some of our results: bilateral cleft, bilateral. We have done 200 cleft missions in Pakistan and Afghanistan. The first mission we did in Karachi in 2004. We were only 4 people who went from Faisal to Karachi, and we did 63 surgeries in 7 days. But now, because the team has grown in number, in the capacity, now wherever we go, we take a full load of equipment. If you ask me, convert this room into OR, within 2 hours, we can convert this room into OR with 6 or 7 tables, with every equipment. And we usually make 2 rooms, 1 room for the lip surgeries, 1 room for the palate surgeries, to make it easier. Everybody knows that they have to prepare the lip instrument in this room and for the palate in the other room. And our work schedule is, we start around 10 a.m. in the morning, but our finish time is, we never know it. It may be 10 p.m. or sometime it may be 12:30 a.m. We run 3 tables for the lip and 4 tables for the palate. And lunch and dinner, they are served in a nearby room. Anybody who is free, he can go for the dinner. Now we have 55-member plus team when we go out for a mission. We have plastic surgeon, we have 6 surgeons in the team, we have an anesthesiologist, we have OR scrub boys, we have an OR anesthesia technician, and some of the anesthesia technician, they have 35 years pediatric surgery, pediatric anesthesia experience. So they are very much experienced. Then we have the medical and nursing staff, the paramedic staff, then every supporting staff we need for the mission. And we provide follow-up to every mission. Like if we come to Anschutz Medical Campus, we would operate the patient over here, but we will do outpatient at 6 cities around the Anschutz Medical Campus. We would bring the patients to Anschutz Medical Campus, operate them here. We will send them back at our own expense, but we will do the follow-up at each of the area. Patient will not have to come back to Anschutz Medical Campus for the follow-up. Our team would go there, they will remove the pictures, they will take the pictures, and at 1 month, our speech pathology would go over there and guide the families how they can improve the speech. And again, at 3 months, he will go back again. So we have 3 follow-ups. If any of the patients, they have problem, either we can guide them or we can call them to our center in Lahore and we provide every care possible to them. So whenever we do a mission, we always pray to the Allah, to pray to the God that we can proceed comfortably, we can help as many patients as possible. This is our first mission in 2004, when we did 63 surgeries in 7 days. Then over the years, we have progressed, we have built the team, our team has become more experienced. And this is a picture, we did a mission in the northern areas, very near to the K2 areas. And these ladies did not go to any family function except their own marriage, because people did not like them to come to their house with this problem. So 50 years, 55 years, 60 years, they just had the life of an isolated capacity. This is one of our mission in 2013 Istiqlal Hospital, Kabul, Afghanistan. So we have learned many lessons from our mission. Initially, we had a very fixed schedule that we will go to Anschutz Medical Campus, we would stay there for 4 days, and whether we have more patients to wait for us over there, we will go back after 4 days. I still remember we had a mission in Islamabad in a hospital, and we were staying there for 4 days. On the one day before the last day, I went to the inpatient area and I made a round, and I made the list of all the patients present in that very area. Next morning, when I was in the OR, one of the father of the kid, he came to me and he literally abused me like anything. He said, "Why did you not put my kid on the lift?" I said, "You were not available when I made the round last evening." He was abusing me like anything, and I kept smiling. And then he became more angry that I am abusing and you are still smiling. Then I realized the pain he was suffering for his kid, because he told me that he took some loan from his friend to come to this hospital, and his kid is not being operated. So then we made our schedule flexible. Now, many times we had to stay 6 days for surgeries because we had more patients. So we never refuse any patient whom we can operate at the mission. For difficult patients with some craniofacial soft tissue defect, we usually call them to Lahore, because there we are available for 6 days a week, so we can help them. But otherwise, our policy now is we will help every patient who has reported to the hospital, so we extend our stay. And then we do not train anybody during the mission, because we have lot many patients. We run 7 tables at a time. We are 6 surgeons. When we finish the surgery, any surgeon who has finished surgery, he can go to the next table when the patient is already anesthetized. When we finish the surgery, we do not make the patient awake right in the OR. We shift the patient to the recovery. We have a very trained OR anesthesia technician who has 35 years experience in pediatric anesthesia. He will provide oxygen, provide all the medicine, and he will make the patient awake. Then the anesthesiologist would go to the recovery area, and when he feels the patient is comfortable, awake, then we will send the patient to HDU. There we have another anesthesiologist and trained nurses. They will keep the patient for 2 hours more to see if there's any bleeding or any breathing problem. When the patient is very much safe, then we will shift to the inpatient area. So every surgery day in mission, we usually operate from 50 to 60 patients every day, because we save time. After surgery, we shift the patient to recovery, so we can do, and everybody knows their job. So if anybody wants to get training, we usually call them to our hospital in Lahore, where we are available 6 days a week. We don't have many patients like we have in mission, so we do not train anybody in the mission. So we run 7 tables. We are 6 surgeons, 4 anesthesiologists, 3 OR anesthesia technicians. We have 10 OR scrub wires. We have circulators. We have extubation in Paku. 2 hours stay at HDU. We do 60 surgeries or more sometime in a day. And then we do public awareness seminars for the general public with some newspapers and TV media organizations. Then how we can develop a team? You need to be enthusiastic that you want to develop a team so that we can help more patients efficiently, effectively, which may be more economical. We can help them. And then you should have the courage and strength to face difficulties and challenges. Even sometimes your colleagues may not be that cooperative, which you expect more from them. Then you need to be very stubborn. You need to have perseverance that I have to do it. It may take long, but ultimately you win. I would narrate an incident. I was in Taiwan in 2008 with Professor Yurechen, and I asked him that I want to send some of my colleagues for training in Taiwan. So he said, answer my questions. I said, okay. He said, if we train your colleague, when they go back, can you apply them at market rate? I said, we can apply them at market rates. Then he said, can you tolerate or digest the development of your colleagues? I said, yes. Then he said, you can be better than us. Science only develops when we progress. My junior colleague should be better than me. Only then we can progress. If only I am better, when I go away, then setup will go down. So we need to encourage, we need to support our colleagues so that they can progress, they can think out of the box. So we need to have a very clear vision and mission what we want to do. We need to be passionate, and we need to employ skilled professionals. Then continuous education and training. We need to communicate very comfortably. There should be no boss, no leader. We should be like colleagues so that we can communicate comfortably. If I have a problem, I can talk to anybody. If they have a problem, they can come to me, they can share their problem. And everything should be centered around the patient care, not my personal growth or my personal development. Then we need to empower our colleagues. My junior surgeon in my team, they do surgery like me 70%. 30% they develop their own changes, their own techniques, and I usually agree with them. If the end result is good, no problem. Then we need to provide resources for their development, do some research out of our data. Then we need to be ethical and compassionate. And then feedback and evaluation is must for our audit feedback and development. We did a mission in Pakistan in 2012, and we did 313 surgeries in 7 days. And we published a paper in PRS Global Open. And these are the surgeries done in a mission. I'm not sure this surgery is done by me or by my colleague. We have lot many adult patients who have never been operated. Probably 50 years or more of age. Then palate, bilateral complete palate done in a mission. So we wrote a paper in PRS Global Open, Model Humanitarian Cleft Mission, 312 surgeries in 7 days. And this paper got Best International Collaboration Gold Award. Then we wrote a radical dissection of greater palatine vessel in the palate repair. It got International Bronze Award. Then we wrote a continuous versus interpreted suture in palate repair. It got Best Southeast Asian Paper Award. These are the different awards our papers got. So I was discussing with Professor Fong in the morning. We have a hesitation to share our complication with our other colleagues because we always want to share our good results. But every surgeon, how much experience he or she is, they will get complication. And sometimes the senior surgeon will get a bigger complication because he is doing a bigger challenging case. So then we started documenting our complication. We started good record keeping. And over the period of years, then we had a good follow-up. Then we could develop some techniques. And now we are the last shop in the market, especially for the palatal fistula in Pakistan and even from Afghanistan. Every difficult palatal fistula, small or big, they will land up to Cleft Hospital. And we have done many difficult cases over the years. And we developed a new classification for the palatal fistula. There have been many classifications before. The most prevalent used the Pittsburgh classification. Then we have Schultz, Osumi, Sunil and Agni. But many of the palatal fistula we had, they could not be fit into any prevalent classification. So we were not comfortable how we can document these palatal fistula. So we developed our new classification. And this is called Pakistan Comprehensive Fistula Classification, a novel scheme and algorithm for management of palatal fistula or dehiscence. And we published it in PRS in 2019. And we also documented how we can classify the dehiscence. So we classified the midline fistula the lateral fistula, the subtotal fistula, and the dehiscence. So we described the location of the fistula, we described the size of the fistula, and we coupled it with functional status of the soft palate. And then we described our algorithm, how we should manage different fistula in different location, with different size, with different velopharyngeal function. I wrote a chapter in a book written by our colleague Jordan from Children of Philadelphia. And then we wrote a new book with Springer. This is 109 chaptered book, 1009 pages. I wrote 56 chapters, and 53 chapters were written by friends all around the globe. And I have been with Operation Smile since 2013. I have been to different countries with them. I operated a patient in Oak in 2013. There are many stories on the internet in the Operation Smile website. And he was working in a bakery, and he used to wear a mask for the whole year around. And he usually used almost all the back streets to go to his job so that the people don't see him. And now you see the picture before surgery, how much worried he is, and after one surgery, how much confident he is. Then he got married and he has now a kid. One of the mission in Paraguay with Dr. Rocio from Ecuador, and then from a tooth-speech pathologist from Brazil. One of the mission in Aswan, Egypt, and one mission in Malawi, 2020. I have been to different Cleft congresses in 2005 to Durban, then Fortaleza, then Orlando. I could not go to Chennai in 2017. Then I was in Edinburgh, Scotland in 2022. Some pictures from Khon Kaen, Thailand 2003, Durban 2005. Orlando with Professor Donald Lobb from Stanford and Bill Maggie from Operation Smile. And I conducted a workshop in Edinburgh for 90 minutes on measurement of palatal fistula. And some friends we met first time, although we were on WhatsApp for the last 7 years, but we met first time in person in Edinburgh. We have a friend from Ecuador. I met him in Paraguay, Dr. Edward Alvarez. He developed a simple speech assessment protocol, how we can assess where the fistula is located in the palate. And he developed WhatsApp group for the cleft patient. And we have 6 groups for cleft lip, for cleft palate, for complication, for speech disorders, for post-op bleeding, and miscellaneous for plastic surgery other than the cleft. So we have more than 270 friends from all around the globe, and almost this forum never sleeps, because if America is sleeping, South Asia is waking up, South Asia is sleeping, South America is waking up, so the forum goes on. Then I have many friends with this cleft WhatsApp group, from Melbourne, from Curitiba, from Amsterdam, from New York, from Seattle, from Chop, from Michigan, from Colorado, from Egypt, from UCLA, and different friends in different times. I have been to Egypt many times. Then I have been to Icoplasty in Peru and Dubai, and then to Japan last year in Nagasaki with Horacio Mayer from Argentina, Dr. Eva Maria from Germany, and she is the president on the right side, president of the Brazilian Society. Icoplasty meeting in Peru. Then a meeting in Korea in 2018 with Professor Myung Chul Park, with Billy Maggie, with Jordan, with Gregory Evans, with Joseph Losey, with Dr. Guillermo from Peru, and then with Nudaf Craniofacial Foundation in Taiwan. So now our hospital provides training to international visiting surgeons for surgeries in cleft lip and palate. And we have 5 surgeons coming up in the end of April. They are going to join with us in a mission in another area of Pakistan. So some fellows from Germany. fellows from Poland, Ukraine, Ethiopia, Congo, Taiwan, UK. Then we have global collaboration with Changu Morir Hospital, with IP University Hospital, International Changu Craniofacial Webinar, Operation Smile Academy. I have been giving webinar with Spanish Society, with Icoplast. We have 2 weeks before, and Dr. Fong was very generous to give his experience about alveolar bone grafting. Then we are member of the Asian Federation of Plastic and Reconstructive Society. I have been giving lectures at Allentown and Pennsylvania and CHOP. So I was involved in a workshop in 2021 for the master course in palatal fistula with very big names. Then I have been to Edinburgh Cleft Congress with the Milan group. Now they are hosting a Cleft Congress in June, end of June, with some Indian friends, with Bob Mann, with Dr. Nolte from Amsterdam. I have been to Morocco for the Cleft Care Conference in December 2022 with Dr. David Fisher, Dr. Alvarez, with Bob Mann. I was in Brazil last year for the Baru Cleft Congress. I have been invited to give my talks for the webinars organized by Taiwan group. So these are the links to my presentation in their webinars. Then we had as I just mentioned, we had 2 weeks before, we had 438 people joining on this webinar. It was very interesting to learn from Dr. Fong, Professor Philip Chen, and Dr. Eric Liu. And we had very good panel of experts, Bob Mann and Dr. Maria Costanza from Italy. So we had 773 registration and 438 people joined. So what's the message I can share to the colleagues who want to develop their team? You have to lead from the front. You have to work more. You must know that there will be many challenges, many difficulties, and you have to sacrifice more to develop your team. Sometimes your colleague may not be that efficient, but still you have to keep them along. Because if you cannot change your colleagues with good experience in your team, you have to digest them, you have to tolerate their some untoward behavior. Only then you can take them along. And I usually try to give them credit. If there's any problem, I will take my responsibility that I was not comfortable enough to do that job. And then I need always, we should be grateful to our colleagues. Only then we can take them along, we can take them working with passion. I always say that people who work 9 to 5 can make themselves comfortable. But if you want to make other people comfortable, then you have to work more. You have to get up earlier, and maybe you will sleep quite late. Then you have to invest your time with your teammates. You have to win their confidence, and you have to be like their colleague, not their boss. They have any problem, they should have no hesitation to share it with you. They did something wrong, they should come and share it with you so that you can find a solution. If I am uncomfortable with my boss, I will always try to avoid my mistakes. I will not tell him. So then we need to be positive even in difficult situations. Then we need to encourage our team members should go to different meetings, different webinars, so they can learn from other people's experience. Then we should appreciate them and we should tolerate them. Then if we have new techniques, we should share, we should train our colleagues so that they can progress even more than us. Then our paramedic staff, we always invest in their training. My OR boys, they do not have any technical qualification, but they have been working with me for the last 15 years. And they know each and every step of our procedure. Sometimes when I go back from abroad visit, especially for 2 or 3 weeks later, I forget one of my steps in surgery. And my OR boy said, Fayyaz, you are not going to do this. So they know every step. If I miss anything, they will remind me, because they know everything which is done at our center. Then, if I don't know anything, I have a difficult case, I would share in my Cleft WhatsApp group. Sometimes my friend's opinion is much better than mine plan. If I do some difficult case and the end result is good, I would like to share it with other friends. If they get a difficult case like this, so they can go like this, so they can help their patients. Then we need to visit many centers, and we need to go with the master in that technique. We can learn firsthand by the top person in the world. Then we can get better and better. Then another way, maybe we can invite the master to visit our center. I have invited my friends from Taiwan many times in Pakistan, and many of the difficult cases, we put them for surgery, and we learn how they can handle difficult cases. Then we need to be humble. We should never be proud, even if we do some good things, because maybe next day you can be put in a difficult situation. So I love to be humble, because humbleness is the height of a human. And then we should do our audit every 3 months. Any difficult cases, any fistulas, any failures, what was the problem, whether it was anesthesia problem, or the surgical technique, or the poor execution, or sometimes the family did not follow the instruction we give. Like I was telling in the morning, that when we do the palate repair, we do not tell the family that the suture will be resolved on its own. We tell them, you come after 1 week, maybe we have to remove the sutures. When they come back after 1 week, they will come to me, Fayyaz, your boys did not remove the suture. I will say, the sutures are not ripe yet. Because if we tell them, we have done the surgery, they will never come back for the follow-up. We need the follow-up, because we want to know whether the surgery was good, whether the surgery was bad. And many times, I have to send my OR boys to 300, 400 kilometers to the family's village to get the picture, because I need the picture for presentation. Family does not need it. So sometimes the family would change their mobile number after every month. So now we take 3 or 4 mobile numbers to keep them in contact. Even then, sometimes every mobile phone is shut. So this is my first visit to Colorado, but I'm not sure. I'm sure it's not the last one, and it has been pleasure to talking with you. And I'm sure with Dr. Fong here, with other friends here, I will keep coming and sharing our experience. And also I will keep learning from your experience. That's the way we can move forward. So thanks God the COVID is gone. Otherwise we were just on internet and we could not meet in person. So thank you very much for your patience.
Any questions for Professor Fayyaz? The audience or even online? We have 33 members joining us online.
Oh, good. Good.
Let's see here if there's anything in the chat. Thank you again for coming, and fill in the Google Doc on the link above if you have not. That's one. It happens to be a meeting at a meeting with also our director of global surgery. I do have a few comments and questions. I would say,
please.
First of all, just so I guess everyone can hear us,
please.
I want to personally thank you for coming here. I don't know if you understand, he came in at midnight last night from Pakistan after 28 hours of travel. And of course, I asked him to do a 6:30 lecture for our residents. And he, without ever complaining, said absolutely. So I do want to appreciate that. I think personally, you know, here, everyone here is very interested in global surgery and are global citizens. And I think we've learned so much from your experience. Many of these, not just from the surgical aspect, but how to create a team. And I think something that we take for granted is the attitude, as well as the need to be humble. You know, to do this type of work, I think we're motivated to help our fellow people, but also to understand how to keep a team motivated, how to really be as efficient and help as many people as possible. You know, when we were developing this lecture series, and I knew you were coming to Denver, I thought this was a perfect opportunity because you have done something that is so rare, certainly within our circles, someone who has helped their country. And clearly you have the motivation, but also the organizational skills and an ability. I mean, this is incredible numbers. And you're now a center where other people are coming to learn from you. And I think that is really the epitome of how to create a program, regardless of resources. So I just want to congratulate you for an amazing experience, sharing that experience with us. We do have a few things. Any other questions from the audience?
Please.
Yes.
Dr. Fab, thank you for the presentation. Wonderful, very inspiring. And you clearly underscored the importance of having a skilled team that believes in your mission. I wanted to ask if you had any advice or tips. Replacing team members, highly skilled and highly trained team members, can sometimes be difficult. Sometimes turnover is an issue. So how do you deal with that? And how do you keep a team longitudinally together?
Actually, in my team, all these surgeons, they were trained by me over the period of years. We do not induct any new surgeon as a surgeon in our team. We will induct, let's say, if a plastic surgeon who have done his post-graduation, he passed their exact exam. When they come to me, they will come as a trainee. And they will work with me at least for 1 year. And we will give them some scholarship. We will not give them a good salary or good amount of money. So for 1 year, if they stay with me, after that, they can become part of my team. And we provide some good amount of money to every team member so that their kitchen goes very comfortably. If we give very petty amount to our surgeon and they have to work somewhere else, then they may not stay with me. Moreover, after every second year, I induct a new person because some of the surgeons, they may leave my team. So I need a new person in the pipeline who can keep my work going on. And then we do not have any volunteer in our team. I pay every member of the team a good amount so they can stay with us, and we give them respect and humbleness so they can stay. When I'm not in Pakistan, even then my hospital works like I'm there. Sometimes they work much better than when I am there. So it's over the period of years when you need to give inspiration, you need to give confidence, trust building to your team members, and you need to appreciate their good work. Only then they can stay. If they have any problem, they have complication, I will sit with them and I will tell them what was the problem, where you have gone wrong. But still, I will maintain their respect. I'm not their boss. I'm their colleague. I'm their brother. I'm their, maybe I'm their father like that. But over the period of years, sometimes you will get a person who is very slow to learn. But even then, we take them along, we teach them, we show them their problem, how we can overcome that. And then over a period of 1 year, 2 years, they become as good as myself. Only some difficult cases, especially for the palate, me and my another colleague, we usually operate on difficult cases in the palate. But otherwise, they can do normal palate, they can do any lip, they can do lip and nose job very comfortably. So it's only, you need to be humble, you need to be respectful to your colleagues, and you need to be passionate how we have to develop the team. Otherwise, if I'm loose-tempered person, then I will be only myself in the team. And when I am away, my center will be closed. Now, last year, I was 1 month away from my center. I was in Austin for the American Society meeting. Then I went to CHOP and Allentown for lecture. Then I went to Paraguay for a mission. I went to Brazil for the annual society meeting, went to Curitiba with Professor Renato. Then I went to Baru for 1 month. My center was working because they work like anything. And when we go for a mission, 55 members of the team, I said that we have to work till 12 a.m., 12:30 a.m., nobody would refuse. Because we pay them for every patient we operate. We have a very robust model of payments. So every member gets, even if he is from OR scrub boy or our driver, we have 2 members of the team who will only prepare our food for the breakfast, for the lunch and the dinner. Everybody gets something out of it. So everybody feels respected and owned by us. Only then you can develop your team. And then we have 2 or 3 people leaving our team, but some people, they are staying with me since 2008. They are our surgeons in our team. So I think that's not a rocket science. That's very simple formula. We just respect and get respect. Take care of them. They will take care of you and your patients. That's it. Please.
I mean, doing more palate surgery than anyone anywhere in the world is really phenomenal. And you kind of, in your humble fashion, show that side of you done. To do that, I mean, it requires consistency, reliability, quality. How did you oversee and maintain that you're performing consistent quality operations on such a high volume?
Actually, I do not do anything except cleft for many years. And because our hospital does only cleft, we do not do any other surgeries. So our team is doing one thing again and again, 6 days a week and 25 days a month, and almost 12 months in a year. Even my OR boys, if I give them, they can do the lip suturing, skin suture perfect, because they have been doing it for many, many years. Even our new resident or new surgeon, they sometimes learn from our OR boys some tips and tricks. So if you are consistent, and we have a very regular team, we do not have any volunteer who comes and goes away. So we have kept our members in the team over the years. So over the year, the team has become more productive, more robust, more economical, with good quality. And because we have in our server, we have a pictures of the patient, more than 27,000 pre-op, post-op, even during surgery. So we record even our own complications. Tomorrow I'm giving a talk in the ACPA for 90 minutes for palatal fistula. Some of the fistula, they are very bad. Some of the fistulas are from our own center. Majority are from other hospital in Pakistan and even from Afghanistan. But because we have a good record keeping, my OR boys, they will go to any mission area where we did the mission. They will remove the sutures without anesthesia, without injuring the lip, without injuring the kid. I cannot do it. But they have been doing it for 15 years. So over the year, they have become perfect. They can even diagnose that this patient needs speech surgery or not, because they are doing the same thing. They are moving in one circle for many years. So that's the way we can keep the quality, and we can record our complication, and then we can develop some good techniques, how we can manage those complications. That's why we could write a very robust book on cleft palate. That's one of the comprehensive book on cleft palate, and the first ever book written on palatal fistula management. Nobody has written any book on palatal fistula because nobody has the experience like our center has, because we are a very large volume center. We get very difficult cases from all over Pakistan, and in Pakistan we get around 10,000 new clefts every year. So we are fourth country in the world after India, China, Indonesia, then Pakistan. So 10,000 is a huge number. So because we are a very focused hospital, so we get many patients from all over Pakistan, especially the previously operated patient, the difficult palatal fistula. So that's the reason.
Any other questions? Well, We do have a few things for you in appreciation. The first thing here is our certificate. Maybe we can take a picture here. Just a certificate of appreciation for your lecture and for coming all this way to give us such information. Social media. Of course.
But you can take with the mobile as well.
Yeah, right. I gotcha.
And we can share in this WhatsApp group.
Of course. But that's not all. We also have carefully curated, so you will remember your experience here
Oh, my goodness.
at the University of Colorado. The next grab bag, the training bag,
Okay.
but many nice things inside there as well. Just a small token of our appreciation. So once again, thank you very much.